Thank you for taking the time to listen to today's program. I am Dr. Mitchell Sheinkop, an orthopedic surgeon. After 37 years as a joint replacement specialist at a major university medical center in Chicago, Illinois, 5 years ago I retired from surgery, exchanging the scalpel for a needle. For these past 5 years, I have practiced cellular orthopedics using bone marrow-derived stem cells to assist patients with limitations resulting from osteoarthritis. In so doing, I introduced the integration of research with a regenerative medicine clinical practice, recreating in the emerging field of interventional orthopedics that which I pioneered during my joint replacement surgical years. I am one of the first orthopedic surgeons, board certified, fellowship trained, to leave surgery and enter the new subspecialty of interventional orthopedics. Simply put, I no longer do joint replacement surgery. Rather, I use stem cells to help patients postpone, perhaps avoid a joint replacement. The sought-after goal is to help the patient return to an active lifestyle. I am eager to talk with you about this topic today, as I myself have arthritis, and the last thing I want is a joint replacement. So today, we are going to cover the emerging field of regenerative medicine. This discipline is not well understood by the general public, and to a lesser extent by the general medical community. In fact, when I first started practicing regenerative medicine, it was so new that not only did the patient population not understand my recommendations, but even my prior orthopedic colleagues had no grasp as to what I was recommending to people. While not accepted by the orthopedic community 5 years ago, this past March, the American Academy of Orthopedic Surgeons sponsored an educational seminar to better educate the orthopedic surgical community as to the potential benefit of that which I am pioneering, namely the use of stem cells to help patients with arthritis live an active lifestyle. While there have been physicians involved in regenerative medicine over the past 5 to 7 years, I was one of the first orthopedic surgeons to embrace this emerging field. Today, in part because of my pioneering efforts, there is increasing awareness among orthopedic surgeons about the potential benefits of interventional orthopedics as contrasted with the potential complications of a major joint replacement. I want to emphasize that these are your cells, no one else's. So there is no chance for disease transfer or rejection, and I strictly follow FDA regulations. It's all approved and compliant. When you have finished listening to this webinar, not only will you know the potential benefits of using your bone marrow-derived stem cells, you will have been made aware of evolving alternatives being introduced into cellular orthopedics, including platelet-rich plasma, subchondroplasty, and amniotic fluid concentrate. My final recommendation for you will be based on medical history, physical examination, and review of your images, and I'll talk more about that later on. Now, I want to share with you a vignette concerning one of my patients to help you understand the potential benefits of interventional orthopedics for osteoarthritis as contrasted to the less than satisfactory outcome of a joint replacement procedure. To protect the privacy of the patient and be HIPAA compliant, I have to change his name, but the story is true. Let's call him Bob. Bob is one of my closest friends and my cycling and heli-skiing companion. After a 40-year skiing and cycling commitment, about 5 years ago at age 67, he stopped his active recreational pursuits because of osteoarthritic knees. He sought consultation with several prominent knee replacement surgeons in the Chicago area, before consulting with me about the potential of avoiding or postponing a joint replacement via interventional orthopedics. After I reviewed his medical history, performed a physical examination, and reviewed his X-ray and MRI images, I completed a bone marrow concentrate stem cell intervention to his left knee 3 years ago. 1 year later, he returned to helicopter skiing and long-distance cycling. About a year later, he underwent bone marrow concentrate stem cell intervention into his osteoarthritic right knee. The very next ski season, he spent 3 weeks helicopter skiing in the Canadian Rockies and continues to enjoy long-distance bicycling on weekends. So much so that he experienced an overuse tendonitis of his right posterior tibial tendon, for which I recently performed a platelet-rich plasma injection under ultrasound guidance. Incidentally, everything that I do is guided, either via ultrasound or fluoroscopy. There is no guessing. So at this point, you may be wondering, why am I sharing this information with you via a webinar? The reason is regenerative medicine is an evolving discipline. When you see an orthopedic surgeon with the symptoms of osteoarthritis and have x-rays taken, you are frequently told, quote, "You have bone on bone and need a joint replacement," unquote. What you are not told is that there are alternatives after you have exhausted the customary and non-operative measures. Up until 6 years ago, patients with arthritis would be managed with physical therapy, weight reduction, cortisone injections, non-steroidal anti-inflammatory medication, and in gel injections. And they are told the only other alternative is a joint replacement. Today, there is an alternative with minimal risk and no incision. It's called interventional orthopedics. Instead of a knife and a big scar with a long-term rehabilitation and a significant risk of complication and premature failure, a needle is used to extract bone marrow under local anesthesia from your pelvis. The bone marrow is concentrated in the process, and your own bone marrow is injected into your own arthritic joint. That concentrate contains anti-inflammatories called cytokines, cellular secretions called growth factors, and mesenchymal stem cells. Acting together, your pain is diminished or eliminated. Your joint range of motion is improved. Your functional capacity is significantly altered, and there is the potential to regenerate your joint. Most importantly, there are minimal to no complications, and you have burned no bridges. If at 2 years or 20 years you decide to have a joint replacement, there is no restriction. Overall, I am sharing this information via webinar to inform you so that when and if you seek consultation in my office, you will have some insight and feel comfortable. Now, if you are like me, chances are you will have some questions as I talk. In fact, you may have some questions now. Simply type in your questions below as you have them, and I will do my best to answer them at the end or within a short period afterwards. Because this information can be so transformational for you, I want you to pay close attention and clear any distractions. What I am presenting today is not only new to you, but also to the general medical community at large. Once we are done, you will be able to educate your own physician. That being said, if you are watching this via a replay, feel free to pause the replay and come back at your convenience. If you are watching this live, obviously you can't pause it, but a replay will be made available. So why is this presentation so important right now? If you are watching this presentation, chances are you currently have osteoarthritis. Ultimately, I want to inform you that you don't have to suffer anymore from the symptoms of osteoarthritis. I have multiple procedures that I perform to eliminate or reduce your pain, improve your motion, potentially regenerate your joint, and postpone, perhaps avoid a joint replacement. I have compiled a database in which the findings pre and post stem cell intervention are entered. I have compared these findings and results to the outcomes of the patients in whom I had performed a total hip or total knee replacement. In comparing the two populations, I find that while patients with hip replacements might have less discomfort at 1 year when contrasted to those undergoing stem cell procedures, at 4 years, those who have allowed me to treat their arthritis with stem cells are far more active than those who have undergone joint replacements. When we compare knee replacement patients with those who have undergone stem cell procedures for grades 2 and 3 osteoarthritis, with the outcomes of stem cell intervention, the patients who use the orthobiologic route have enjoyed increased activity, do not have to worry about a revision procedure, have no incidence of blood clots, or have little to no risk of an infection or a stiff knee. Additionally, you should know the best time to intervene with regenerative options is before you develop grade 4 osteoarthritis, in which case you will be stiff, debilitated, or deformed. When these happen, you will need a joint replacement because it is too late. That's why I am excited for you that you are watching this webinar right now. I want you to take a moment and imagine what your life would be like with little to no pain in your joints. For many of you watching, I'm able to give you that possibility. Not only could this allow you to get your active lifestyle back, there is scientific evidence it may reverse the arthritic process, at least stop progression. I want to reemphasize we are not burning bridges. The procedure is done under local anesthesia to minimize risks. The rehabilitation is prompt and the complication potential is minimal, if any. And when compared to an outcome of a joint replacement, those that I personally did, this new opportunity with orthobiologics is something you should seriously consider. I have osteoarthritis of my knees, and I was beginning to alter my recreational undertakings because of pain restrictions. Having done knee and hip replacement surgery for over 37 years, the thing I wanted least was knee replacement surgery. After I gave up surgery, I kept on following my patients, and I became aware of the large number of less than satisfactory outcomes, as well as the need for revision of joint replacements, especially in the active population. Because of my personal health profile, and because the reality that a patient undergoing a joint replacement before age 65 will probably need a second or perhaps even a third joint replacement in their lifetime, I began to look for alternatives to major surgical procedures. I learned of the stem cell work being done in Europe, especially in Germany and France. For instance, Kobe Bryant, with an arthritic right knee 5 years ago, traveled to Germany for a stem cell procedure and returned to enjoy 5 more years of professional basketball. I decided to become knowledgeable and train in the new field of regenerative medicine to both benefit my patients and to benefit myself. Over 4 years ago now, I opened a practice based on a needle rather than a knife, using minimally invasive procedures for the care and treatment of osteoarthritic-related symptoms of the knee and hip joint. After the cellular orthopedic intervention into my own left knee, I returned to active skiing and regained the ability to enjoy an unlimited fitness profile as well as a full outdoor recreational menu. Now you know why I've given up surgery and embraced this new discipline. So at this point, you may be wondering what you should expect should you want to come in and talk more with me. I will perform a medical history and physical examination as well as review x-rays and MRIs. I will provide you with a complete informed consent process, walk you through the various steps of the procedure, and answer your questions. Should you elect to proceed with a regenerative medicine procedure, you will receive a preliminary injection into the arthritic joint. Several days later, you will arrive in our surgery center, and under local anesthesia, you will be placed on your abdomen. I will manually identify the bony landmarks from which I will extract your bone marrow. Prior to the procedure, I will confirm the anatomy with an ultrasound unit or at other times with an x-ray unit, scrub your back, drape it, and administer local anesthetic. The extraction process is well tolerated, and I converse with you during the entire 15 to 20 minutes of bone marrow extraction. Thereafter, you go into our recovery room while the cells are concentrated, processed, and made ready for injection into your arthritic joint. 1 hour thereafter, you are returned to the surgery center, wherein the bone marrow concentrate stem cell preparation is injected into your arthritic joint using ultrasound guidance in the knee or x-ray guidance at the hip. You are then transported again into the recovery room and discharged walking in 45 to 60 minutes. 48 hours later, you return to my office where a proprietary platelet-rich plasma intervention takes place to the arthritic joint. I then follow up with you periodically to assure your satisfaction and that my targeted milestones are achieved. Part of the follow-up is subjective, most is objective and reproducible, lending itself to statistical analysis. That data not only serves to educate the regenerative medicine community and add to the scientific information pertaining to stem cell intervention, but it also helps me constantly refine my techniques, thus allowing me to provide the most contemporary treatment modalities. When you schedule your initial appointment with me, you will learn that your consultation is covered by private insurance or Medicare. You will also be told that at this time, cellular orthopedics is not indemnified, and you will learn about the fee schedule. You will also observe that our fees do not begin to approach the cost of a mouth reconstruction and are comparable to your insurance deductible. So at this time, you are probably saying, Dr. Sheinkop, this all sounds great, but will this work for me? I base my recommendations both on the medical history, physical examination, review of your x-rays, and MRIs. My recommendations are not based on a single case anecdote, but rather on repeated analysis of the outcomes gathered in my database. I have learned in over 4 years of regenerative medicine experience what works, in whom, and when. At the same time, I have learned not to offer cellular orthopedics when there is advanced grade 4 osteoarthritis indicated by stiffness and deformity. In that case, I will refer you to a joint replacement surgeon. Let me share a few patient stories with you. This first story is of Doris, a 58-year-old woman who presented to my office with an osteoarthritic left knee causing her pain and limited function. In particular, she could no longer sit in a classroom height seat as an elementary school teacher. Her past medical history indicated that 7 years earlier, she had undergone a right total knee replacement. Over the following years, she had 3 manipulations to improve the range of motion and finally an open procedure to remove scar. She was left with a very stiff, painful knee and didn't want to risk that happening again on the left side. I performed a cellular orthopedic intervention to her left knee using the technique I described earlier in this webinar. and 8 weeks later, she was back in the classroom. When last seen at the beginning of this summer, she was thrilled with the long-term outcome and continually refers other patients for management of an arthritic joint to me. Let me now share with you the outcome of a hip intervention on a 54-year-old banker. He had delayed fatherhood, so at the time he saw me with his arthritic hip and the inherent limitations, he no longer could enjoy any recreational activities with his family. His hope was he could postpone or perhaps avoid a hip replacement with stem cell intervention. 6 months after the orthobiologic procedure, he took his family skiing in Colorado, and when last seen, earlier this summer, he had already scheduled a ski trip over the upcoming Christmas vacation. This next story is a recount of a 78-year-old man with osteoarthritis of his knees. Let's call him John. John spent every Sunday at a military cemetery escorting a deceased soldier as a pallbearer. But his true commitment was to act as the key individual to bring the folded American flag to the parents. He felt, as a veteran himself, that it was his obligation to do this. Over a period of several years, he noticed a decline in his ability to walk any distance or on uneven surfaces. Before he was forced to withdraw from his passion, he came to me for help. 3 months after his stem cell intervention to his right and left knee, he reported he was once again able to fulfill his service. Now, I could go on and on all day and night with more stories, such as this wounded warrior from the Iraq War who became opiate addicted due to the inability to cause healing of a complex fracture of her ankle. 3 months after her bone marrow concentrate stem cell interventions, her fractures had healed and she was weaned from her 10-year addiction to narcotics. Success stories go on, but rather than base my recommendations for you on an anecdote, my recommendation for you will be based on science and data. I have shared with you on this webinar the reasons to consider a stem cell procedure of an arthritic joint or a failure to obtain fracture healing after trauma and multiple surgical procedures. I have provided you with an informed consent process telling you what will happen should you seek consultation, how the procedure is done, and what you may anticipate should you elect to avoid or postpone a joint replacement using stem cells. Your next step is to contact our office to schedule your initial consultation with me. That initial consultation is covered by insurance, so you can learn if you meet my inclusion criteria. For the sake of thoroughness, be aware that if for some reason, albeit to a systemic illness, recent radiation or chemotherapy, or medical dependency, that would minimize your potential success using stem cells, there are alternative orthobiologic options that I will share with you during your consultation. As a principal investigator in several clinical trials, I will be able to inform you about the future of orthobiologic. Let's see if we have any questions come in. Let's see. This is a great and very common question, and it is, doctor, how painful is the procedure? Well, 95% of patients choose to use local anesthesia to minimize risk and postoperative complications, and I have yet to meet a patient who is sorry they have gone that route. That being said, patients report pressure but not pain. And when asked if they would do it the same way in years to come if they came to a repeat procedure, the answer has always been yes. Let's see, another question that came in was, Doctor, how long will the benefits last? And this is also a very common question. Through my scientific analysis after 4 years, 87% of patients are very satisfied, but since we have only been doing it for over 4 years, I don't know what the future holds. If after 4 years a symptom returns, we can repeat the procedure. Let's see here. This question said, Dr. Sheinkop, you have talked a lot about patients who are over 45 on this webinar. What about patients who are under 45? I think I have spoken a lot about patients over 45 because I am a senior personally, but I also treat patients under 45. For example, I have treated a 36-year-old man who was a marathon runner, and he had not been able to run in a marathon for 2 years because of knee pain secondary to premature onset degenerative arthritis. So, after a bone marrow concentrate stem cell procedure by me, he then ran a full marathon. I have also treated a 42-year-old hockey enthusiast. He is a lawyer, but his passion is hockey. He came in because he had a pain in his hip and could no longer partake in his passion on weekends and evenings. 4 months after my procedure, he was back on the ice. So the answer to your question is the only age limitation is skeletal maturity, which usually occurs at around age 16. And at the other extreme, a physiologically debilitated person is not a candidate. But age itself does not prohibit a successful outcome. Well, we have time for one more question today. If your question did not get answered, I or a team member will respond to you offline. The question is, what are the risks and complications? To date, I have not had a patient who has had an infection, prolonged pain from the harvesting site, and the regeneration of bone marrow is such that the procedure may be repeated in 3 months should there be a desire to treat yet another joint. Additionally, we can do more than one joint in a single session, especially for those coming from afar. So at this point, I want to thank you for attending the webinar. I look forward to speaking with you to answer any further questions and meeting with you at the time of your consultation. It would be my privilege to introduce you to the new world of regenerative medicine. Thank you so much.